Good afternoon, colleagues. My name is Dimakatso Sebopa, and I'm the Deputy General Secretary of DENOSA. DENOSA would like to take this opportunity to thank all the nurses and doctors that are hard at work ensuring that patients infected with COVID-19 recovers well, as well as providing those that need testing and management thereof. We further wish to advise nurses about safety and protection in the workplace in the era of COVID-19. Our first point of entry in this regard is that we need to follow the guidelines on prevention of COVID-19 issued by the WHO, the National Institute for Communicable Diseases, as well as the Department of Health. We are all urged to frequently wash our hands for 20 seconds with soap and water. And for nurses, it is important that we wash our hands before and after we touch the patient, after we've touched the patient's surroundings, and as and when we are exposed to bodily fluids like blood. We are as well urged to enclose or cover ourselves when we cough or sneeze. We are further urged to maintain social distance, and that is inclusive of touching and shaking hands. At this point, it is essential that nurses receive training on management of COVID-19. This would allow nurses to assist patients and allay their fears in the event that they come into health facilities and seek help. Therefore, it is our view that employers should have started by now giving nurses in-service trainings or on-spot trainings on COVID-19 management. It should not be taken for granted that identified hospitals are being given to say patients should go there. Patient can get at any facility at any time, and they need to get the care that they expect to receive. And in South Africa, we know healthcare is being run by nurses. So at a clinic in Lusikisiki, you're most likely to find a nurse there. So we are appealing to nurses that seek this training. We further urge nurses to make sure that they are in personal protective clothing. That includes your masks, your gloves, your goggles, and your aprons. In the event that these things are not granted to you, please do not assume responsibility of managing a patient infected with COVID-19 or who claims to be infected with COVID-19, because chances are that if you don't have knowledge, skill, and competency, you will compromise the very same patient that you'll be trying to assist. If you are not in protective clothing, you will compromise yourself, the patient, as well as your colleagues. So ensure that you demand or insist on these two areas that I have just mentioned. Colleagues, if you are going to be using masks, make sure that your masks fit your face very well. They must enclose your nose and your mouth so that the particles should not go through. In the event that you are using gloves, make sure that you wash your hands and insert the gloves. After you've used the gloves, wash your hands and dispose them responsibly. Please ensure that you follow institutional protocols in this regard. Further, colleagues, it is inevitable that some of us would be infected or are already infected with COVID-19 and will remain asymptomatic. Therefore, as and when you suspect that you were in contact with a person with COVID-19, or you think that you might be infected or you fall sick, please stay at home. But importantly, inform your employer about your situation and kindly do it in writing. Further, seek medical attention immediately and use the 086 number helpline provided by the Department of Health. At the end of the day, when work is done and we are about to go home, colleagues, let us ensure that we get into the routine of washing our hands again before we touch any of our belongings that we will be taking home. We should not be touching any other surface after that. Remember, it is the employer's responsibility to capacitate you so that you may render your service effectively. It is the employer's responsibility to give you protective clothing because in terms of law, they are required to do so. But it becomes your responsibility as an individual to protect yourself, protect those around you who are your colleagues, as well as the community. Once again, DENOSA would like to thank all the nurses, the doctors, and everyone else involved in this crisis to ensure that COVID-19 does not escalate to the levels that the nation would not be able to manage it. As the President of the country have indicated on Sunday, we can only beat COVID-19 if we work together as a country. I thank you.